and that can sometimes facilitate viral entry. We haven't proven that with coronavirus, but other viruses it seems to, so it's probably the same here. So cases are increasing. I got asked the other day, are we in our second wave? Well, if you look at the curve, there was wave 1 at the beginning, a little more in the summer. That was sort of a post-wave 1, and now we're up like that. So yes, I would say we're in a second wave. A matter of semantics. There's no real exact scientific definition of a wave. But when you look at the curve, they look like waves, and it looks like we're in the second one, so let's call it a second wave. As far as where are the problems the most, there have been some scientific studies looking at the epidemiology of where infections are occurring, and as I've been suggesting all along, it's in areas where there haven't been any restrictions and where people haven't been wearing masks. And that's been the Midwest and the Near West and the Upper Midwest for the most part. And those places are really getting slammed right now. If you look at the numbers per 100,000 people, which is the way to compare numbers between places, northern Wisconsin, 170 per 100,000 people. Same in New Jersey, or same in North Dakota, South Dakota, Illinois, northern Illinois, it's about 130 per 100,000. Iowa, it's about 140 per 100,000. I could go down the list. You can look them up on a lot of the dashboards, but it's so their hospitals are pretty stressed out, and they're having to take and cut back on elective surgeries and elective admissions for procedures so they can take care of their coronavirus patients. So here in the Triad, not quite as bad. So our rates here in Forsyth County as of yesterday were 37 per 100,000. The state is a little lower than that, roughly around 30 per 100,000. There are some counties in North Carolina that are even lower. And then there are some counties that are a little bit higher. So you can kind of keep track of this now, and if you go to the North Carolina DHHS coronavirus website, you can look at a map of North Carolina which takes the counties and makes them yellow, orange, or red, and red being bad, yellow being a little bit better, orange kind of in the middle. And so you can kind of see how we all are doing amongst each other. 3 weeks or so ago, it was the rural counties in North Carolina that were driving things. I think that a lot of the urban areas have caught up. For instance, here around Winston-Salem, our numbers in Winston-Salem roughly reflect that of those of the counties around us now. So the numbers are increasing in the state and in the Triad area. Not increasing as fast as they are across the other country. A little bit of good news, North Carolina as a whole is actually the second best state in the whole country as far as the rate of increase of coronavirus. So we're not hurting quite as bad here. Our hospitals, while there are more coronavirus patients in the hospitals now than they were a month and a half ago, I know of no hospital who's had to pull out alternate care plans, cancel regular or elective procedures, or alternate staffing. So we're able to take care of the patients that we have now like we usually do. And we can do it safely. All of the hospitals that I know of in the state and in the area have been doing fantastic in preventing transmission of coronavirus to other patients and to staff members. And you know, hospitals are a workplace just like any other workplace, and occasionally we have staff members who are infected, and they are getting infected on the outside through their social or family activities. The numbers are small, but we are able to continue taking care of our patients in a safe way through our employee health and our contact tracing. So other workplaces around are also having problems with cases occurring in them. You remember the courthouse outbreak, which I think is finally ended. And it has to do with lunch. and breaks. And when the masks come down and you're eating and you spend 30 minutes socializing with the people around you, usually in small rooms and close quarters inside, transmission is facilitated. And that's one of the things that's driving our numbers right now. The big thing driving our numbers, though, are household transmissions and social transmissions. Small groups of people getting together, neighbors, friends, having family members that you're normally not with, and then getting together. People are doing it more indoors because it's cooler outside, and transmissions are occurring. So that's really what are driving our numbers in the area. And if we don't change what we're doing, the numbers will continue to increase. So here's what we need to do, and you've heard it before. Limit the numbers in your gathering. In fact, right now the safest thing to do is have your social activities be with your family, your own family, in your household. If you have people that you have potted up with and made agreements with to basically have a covenant to have low-risk activities, then you can have bubble fusions with them. But I would limit my bubble fusion to 1, and that includes for Thanksgiving and Thanksgiving dinner, which means it should be a quiet, intimate Thanksgiving this year and not large family gatherings. And you've heard this not only from me, but from the governor, from all public health entities, from the newspapers, from the radio. So we're all on the same page with it. A small, intimate Thanksgiving. And when you do your activities, do them outside. And if you have another family member in the house and they're not usually with you, you need to mask and social distance, even though they're a family member. I know it seems odd and weird, but it's the right thing to do, because 30 to 50% of people who have COVID are asymptomatic, and you just don't know. So just assume everyone has it and take your precautions around everyone. And we can get those numbers back down again and slow it down even more. So that's a little bit about what's going on with our numbers and what's happening with the transmissions. So another thing that's come out in this last week is just reinforce more information that we've been gathering over the last few months. So the virus is transmitted through the air and directly from person to person, not so much from surfaces, okay? And so doorknobs and elevator buttons and desktop surfaces, telephones, so on. And does anyone ever use a telephone off a desktop anymore? Maybe not. But if you do, it's probably not a problem. We just are not seeing cases from surfaces, even though we've been looking for them. It's through the air, and it's through the air within 6 feet or so from a person who's infected. So what does that mean? It means you do not need to be hoarding Clorox wipes, okay? Which are now leaving the grocery stores. In fact, let's talk about that a little bit. So it seems like people are going out and trying to stock up on all sorts of things again. Toilet paper, paper towels, Clorox wipes, certain foods, so on and so forth. You don't need to do that. In fact, the grocery store people and the food distribution people are saying that this year, actually, through the winter, they're going to be able to keep up. So you really don't have to worry about these big shortages like we had last spring. So let's stop hoarding. The other day I saw somebody load 30 grocery bags into their car. And maybe a big Thanksgiving dinner, which you also shouldn't be doing, or it's people buying more than they need to. So take a deep breath, and you go to the grocery store and other and pharmacies and such, and just realize that stuff's going to be there for us, and we don't have to worry so much like we did last spring about that. Let's talk about medications a little bit. So a few new things that are out. The monoclonal antibody that Lilly made, they got an emergency use authorization 2 weeks ago, is now being distributed. It's taking health systems and hospitals a little bit to ramp up to get that out there because it's not really easy to do. It has to be done by vein. it takes an hour to get it into a person, and then you have to sit for an hour afterwards to make sure you don't have a reaction from the medicine. And so it's a little bit more difficult. You can't just write a prescription for it and off you go. So hospitals are working on that. Different health systems in different places are using different criteria for who they find eligible for it. And I think after 2 to 3 weeks, we'll know who it's working for the best, and we'll even that out. So just be aware for a while. You might see some differences between different places, and that's just because the amount of medicine that we have is small, and we want to make sure that the people who get it are the ones who will benefit the most. How well do you benefit from getting a monoclonal antibody for COVID? Well, if you're in the hospital, the studies show you don't benefit at all. It's too late. The virus has done its work, and it's now all inflammation, and the viral counts aren't high enough to make any difference. So we don't give it to people who are sicker. You need to get it in the first 3 days of illness, basically. 3 to 5 days of illness. So if it's been within 3 days of your positive test and within 5 days of symptoms or so, it looks like the antibody might benefit you. How much does it benefit you? It reduces your risk of hospitalization if you have higher risks, like other diseases or advanced age. It'll reduce your risk of hospitalization from about 9 to 10% to 3%. So it's not huge. It's not a magic bullet. I think it's just a stopgap until some other drugs are available. What would those other drugs be? There are oral drugs, kind of like Tamiflu, that are going through clinical trials now. And the early data looks promising. They're like Tamiflu. They take the edge off the symptoms. They reduce your risk of having a complication. And then for certain people, they'll reduce your risk of hospitalization or death. So these medicines, these oral medicines, when they come out, will help. And it can be done by a prescription, and you can pick them up from a pharmacy. And you don't have to go find an infusion center and all of that to get a monoclonal antibody. So that's I think, some good news on the horizon. The other thing you've been hearing about this week are vaccines. Moderna released its results for its messenger RNA vaccine, and it's very similar to Pfizer's. They're both around 95% efficacy. Excuse me. As time goes on, that efficacy will come down a little bit, because every time a vaccine comes out, it always looks best from the trial. And then when we start actually using it, it comes down a little bit. But man, even if it comes down a little bit from 95%, that's still really good. I mean, that's up there with some of the best vaccines that we have, like measles and vaccine and rubella vaccine, polio vaccine, so on and so forth. And so I'm really, really encouraged by that. I couldn't have hoped for a better result from those vaccine trials. The early safety data looks good too. Pfizer's vaccine's got a little bit of fever with it and a little bit of achiness where the shot was, but a lot of shots will do that. A lot of vaccines, so it's no different than that. And boy, when we go through and look at the rest of the safety data, which is being analyzed right now, and if it looks the same, I think we got it. I think we got it. Vaccines will probably start coming out in late December, and it'll be healthcare workers, people in nursing homes, and people who work in nursing homes will be getting it first. The amount of vaccine available initially is going to be small, but as time goes on, it'll ramp up, and then we start doing people who are older and have coexisting diseases. And then the healthy people get it after that, and then the kids will get it after that. And that's sort of the focus for vaccine. That is, I think, is going to be our ticket out of this. It's not going to be herd immunity. Herd immunity, that if you want to do that, it's too dangerous. Too many people will die. We already have 250,000 deaths in the U.S. That was announced this morning. But we need to get the population immunized. Much better to do it through a vaccine than from getting COVID and risking health and lives from that. What do I see for the future? I think to be quite honest, the next 3 to 4 months are going to be a long slog for us. It's going to be the heat of the heat of the winter. That doesn't make sense. The heart of winter, and viral cases of COVID are going to continue to go up. Our wave will continue to get bigger, I think. We're going to really need, now's the time to start thinking about hunkering down, and really curtailing your social activities, and those things, what you're doing. Can you go shopping? Yes. But I would really think once, think twice, think 3 times about going to a drinking establishment. I would think about it before going to a restaurant. You're going to really need to want to go to that restaurant to go to one right now. And fitness centers. Those are still our 3 biggest areas where people go where COVID's transmitted. So I think it's time to start thinking about cutting back on all those, both for your own safety and also to help keep our numbers down. Let's talk a little bit. Oh, I was telling you about where we're going. Anyway, it's going to be a long-hauled slog through the next 3 to 4 months. But I think as vaccine starts coming out and the months start getting warmer again, which down here in North Carolina starts in March, daffodils start springing up, and things are going to start looking better. So I would set your eyes out and set for that time. I mean, pretend like you're a bear. Hibernate for a while and then come out in spring. And I think that things will be getting better. Through the summer, they'll even be getting better yet. By fall, we might actually be able to do some normal things. Will COVID have gone away? No, not totally. It won't. We'll still be wearing masks. We'll still be personally distancing, because it's going to take a while to get everybody vaccinated. And even then, these social things that we do, distancing and masking, get you this far. Vaccine might get you this far also. The 2 together are going to get you this far. They'll be synergistic. And so we'll still be doing that in the fall, but hopefully by Christmas time next year, you're going to start thinking about traveling again and doing stuff like we did before COVID. But we all got to be in this together. It means we got to keep on with our social distancing, our masking, get vaccinated when it's your turn. And I see a rosy horizon for us. I wanted to say something here lastly about schools. So a big congratulations to Davidson, Elon, Duke, and Wake Forest for getting through the season in person. They did it. Thanksgiving comes around, so in about 5-6 days, that's the last of classes for them. And our college kids will be going home. For college students going home, they should be laying low right now, chilling out, pretending like they're in quarantine, going to class, studying, but laying off all the other social activities, so that when they go home, they're not bringing home virus. They can get tested, and they are being tested at the different schools before going home. And then once they're home, they should lay low and for a couple weeks until they're sure they haven't had virus. If you want to get tested again when you get home, that's fine too. But man, you did it. Congratulations. Why? How did that happen? Strong leadership, a committed student body that was considered themselves as a primary stakeholder, and other things like testing in the schools and targeted testing or mass testing. There were different approaches. I think the colleges are going to be kind of getting together here over the next month or so and see what worked and what didn't work so much, and then start getting ready and getting going for springtime for their semester. Opening in spring is going to be tougher because there'll be more virus around. But as far as I can tell, everyone's committed to doing it. A little bit of a word about other school systems, like our public schools. So you'll see different things across the country. Some schools are staying open and doing great. Other schools are getting fearful and shutting down. New York shut down their schools today. which probably didn't need to happen. But a lot of places are just doing it because they did it last spring. I think that the schools that have gone forward and have been open this fall have found it can be done safely. And but the transmissions of virus in the schools are basically almost non-existent. When it does happen between teachers, it happens at lunch or around the break room or in a social activity outside of school. There's a few cases associated with school that are in after-school athletics, and I think athletics will need to be revisited a little bit. But I read with interest here in Forsyth County, and I talked to some people and heard about the school board meeting on Tuesday night. So here in Forsyth County, they've decided to leave school open through first grade for the first graders, which I think is fine. I don't see any problem with that. It's going well for them. But they're not going to be bringing back any other grades until January. Quite frankly, there's a group of people that have been extremely vocal, and they've developed kind of a life of their own in a crusade against opening schools. And there's a lot of misinformation, disinformation, and ignorance of science, quite frankly, in that group. And that's going to keep schools from reopening in Forsyth County, unless they start thinking about it a little bit more. I don't see Forsyth County schools opening at all, maybe even to 2022, as long as this is going on. And it's just an appeal. I think we need to look at real science, and the schools are safer than the Halloween party. The schools are safer than going to a brew pub and getting pizza. The schools are safer than having friends over to your house. The schools are pretty much safer than anywhere else around. Our bars are open, our restaurants are open, our fitness centers are open. These are play areas for adults, and we won't open our schools. Shame on us as a society. What's important? So, I know it's a little bit of a political comment. It does not reflect the views of Wake Forest Baptist Health or anyone else around. It's just my opinion as a scientist, as a parent, as a doctor. Anyway, it's just something to think about. So we're going into Thanksgiving. Time to take a deep breath. Time to relax. Enjoy the family. Have a meal. And we've talked about all the ways to be safe about it. I know we can do it, and it'll be a little bit of a respite for COVID, I think, from us. But it doesn't mean we can't let down our guard. So happy Thanksgiving to everyone. We'll be back here in 2 weeks, and we'll see where we're at and where we're going. And we're going to talk a lot about vaccine in 2 weeks, and we'll go through a lot of the data so that people can know what to expect and how it's going to be distributed. And go ahead and submit questions for 2 weeks down the road about vaccines, and then we'll answer your questions at that time. You guys have any questions this morning?